recently concluded the NEETPG entrance examination. Our core members who are presently doing internship, okay, they have secured excellent and outstanding ranks, and they have shown it's possible by helping others. It will in turn it will help us only to do better. So I would like to introduce my team and talents and their achievements to you all, so that others also get inspired by their achievements to do more and better. First of all, I take this privilege to introduce one of my best core member, that is Dr.Keshav Garg, who is presently doing internship at most prestigious Maulana Azad Medical College, New Delhi. Welcome to you, Dr. Keshav, and hearty congratulations. Very well done. He has secured an amazing rank of rank 6. Rank 6 in internship is incredible, and we are really proud of you. And your contribution to Vitam is really immense. Even in final year, you have presented so many cases in as a final year, and in internship, you have contributed so many videos to Vitami, and with which all the juniors, even the PGs for that matter, understanding the concept much better with your explanations. They are loving your series on vital parameters, pulse, many other videos. So excellent job, dear Dr. Keshav.
Thank you,
What's your remarks about your achievement and your preparation?
So I basically started for the preparation in internship only. Before that, my main focus was on reading the standard books. So it was only the internship when I was more focused on the NEETPG preparation.
So when you started in the internship, so how did you manage both your hectic internship? MAMC, we know how hectic it is in internship. So,
Yes,
so how did you manage to carry out your duties in internship as well as simultaneously prepare for your examination?
Sir, I got 2 hours fixed every day. For me, it was in the morning from 5 a.m. to 7 a.m. That it was fixed that I have to study every day from 5 a.m. to 7 a.m. Other than that, if there was any time in between the posting, at that time I used to do the question bank, and then used to review it in the evening if I could get time.
So last 1 month before the exams, what is your strategy and what you are doing? How many times you revised? What was your revision strategy?
So, when I started my first revision, from that only I used to make concise notes of 5 to 6 pages. Like I concise each subject in around 10 pages, so that I could revise the whole subject in 1 to 2 hours. So I did around 2 revision in the last month of the whole syllabus, and along with that, I did previous year questions. First round I did along with the first revision, and in the last one again I did previous year questions of all the subjects again.
Keshav, what's your strategy of solving an MCQ? What do you find is the best according to you?
Sir, it depends. Like if it is a long stem question, then I usually read the last line first, so that we can get oriented what the question is asking. After that, the options, and then I used to go back to the question, so that I can know which subject they're asking, which area they're asking, so that then when we read the stem, we can understand it more properly.
On the exam day, how was the stress level, or how did you really perform on the day of examination?
I didn't study the day before exam, and we were only I was just with my friends, so I was quite chilled out on the day of the exam. Not very much stressed.
How many questions you attempted?
I attempted 199. I left one question.
One question, and why?
That question was on some plan in PSM that was introduced 70 years ago. So I had never heard of that, so I left that question.
Okay, fine. So what's your suggestion to your juniors? So even they want to achieve like you. So how is it possible, really?
For me, the discipline is very important. If you have a discipline, if you can get a regular routine of studying 1 to 2 hours a day, so anything can be done in internship also. And also, you should have a larger goal so that whenever you are at your lows or you are not motivated, at that time you can think of that goal and it can boost up your confidence.
I also usually tell the same thing to my juniors or my students. See, if you spend, just like Keshav is the best example for that. If you just spend 2 hours extra, like it may be a bit tedious during the internship, but if you spend the 2 hours extra, if you work hard, really hard, then you may save 1 year. You may save 1 year after the internship. So that's a wonderful strategy Keshav adopted, and he really worked hard amidst his hectic internship. He made sure that how much or he was tired or how much of the workload was there. Every day, 2 hours of study. So that regularity or the consistency is the key. Every day he made sure that when he back home, he studies for 2 hours, and his preparation strategy was also wonderful. He studied all the previous year questions and solved as many MCQs as possible. And more than everything, just like he told indirectly, the previous day he was very cool and composed. On the exam day also, he was totally focused. So there was no room for any stress to build in or to take away his performance. So wonderful, dear Keshav. I understand you are with your parents. They have come from all the very long way to meet you. So you have to spend precious time with them also. So we once again, on behalf of the entire White Army team, we congratulate you. It's an excellent feat, amazing feat. Okay, so incredible feat.
Thank you so much.
We would like to, our members would like to learn more from you. So hope you take up a desired PG seat in a very premier institute once again, and continue to teach us, inspire us, and admire us. Okay, so keep in touch, Dr. Keshav. And I'm sure you will contribute much more to the medical field, and you will become one of the best doctors possible in the near future. Thank you so much, Dr. Keshav.
Thank you, sir. Thank you so much, sir.
Yeah. So next up we have Dr. Priya Ashok. Are you there, Priya?
Hi, sir. I'm there. My video, I can't turn it on with my internet. Am I audible?
Yeah, you're audible clearly, but
Okay.
if possible, please try to switch on your video. We'll see, because the girl who made a significant contribution to our White Army, everyone wants to see and witness how it's possible managing both White Army, presenting so many cases, and contributing so many MCQs and other things, simultaneously doing internship. And she has attended almost all the conferences and quizzes and other things during internship and final year. And hers is a very inspiring story. Priya's is a very inspiring story. So we would like to see you, Priya, in person, and if possible, see what's your success stories, Priya?
So am I audible?
Yeah, you're audible.
Okay. So can you please repeat the question? My internet is just... So I can't hear you.
Yeah, now you're audible.
Okay, yeah.
Please go on. What's your success story? What made you to achieve such a good rank in internship itself? That too, working in again very hectic internship at MSRMC Bengaluru. You made it possible in internship to get a good rank. So, what is the secret behind it?
So the first thing I would like to say is a positive mindset. I mean, like, I remember when I started internship, you told me that, no matter what, just do not think about the results or don't think about dropping a year. Just, try it in the very first attempt and, like, do 50 MCQs every day and review them. That is it. So I believe that I did start my preparation quite late, in fact. But I was like, fine, no matter what, I just want to, study properly, revise properly. And with whatever time I had left, I was like, fine, I will give my attempt with, full dedication. That's it.
So what was your revision strategy was like?
So it was
How did you
mostly,
revise?
my preparation was like mostly towards the last 2 months. Like it started in Jan. So I first started with like GTs, giving grand tests and then figuring out which subjects I was really weak at. And then I would just do previous year's questions from those and just revise onto that. So whatever questions I would do wrong, I would go back and read up on those topics. And I did make use of this textbook called First Aid, which is used for USMLE preparation because it has very beautiful things in a concise manner, flow charts and all the tables are given. So I mostly stuck to that.
So on the day of examination, what was your mindset was like?
I was totally relaxed, I would say. So the thing was, this is something I would like to tell everybody, like before, writing the exam, first of all, like make sure you know where your center is, reach early, reach 1 day before, figure out where the center is so that even if there's like any last minute change, you're fine. And reach the examination center at least 3 hours early or 2 hours early, which is what I did. And I had breakfast, I had a good sleep, I went. And I knew that 3 hours are there for 200, 220 minutes for 200 questions. So I was like, fine, 100, first 100 minutes, I will just solve all 200 questions. And based on that, just take mark and review those which I'm not very confident about, and those which I'm really not sure of, I would just skip it and come and review it in the ending. That's all.
So Priya, how you're a perfect all-rounder. Okay, you manage everything so nicely. We always in Vitami we call her as perfect Priya. Okay, perfect Priya. She manages everything so nicely, so well, and she's not just manages. She's good in everything. Okay, so she writes books. What else she does? Neha, her good friend, she's a better person to tell about her. Okay, Priya, how is it possible to manage everything?
So it's just getting, setting priorities right, staying organized, doing small things consistently over a large period of time. That's all. Like from the start of internship, I was like, I will focus on internship because I've seen a lot of people who do skip internship for preparing for NEET. I was pretty much from the beginning, like I will focus on my internship no matter what. And in fact, I would say, like, out of all those questions that did come, so many of them were things I was able to answer because, there were questions that came on hernia alone. Because I went to the OTs, I would start reading up on anatomy and stuff. 3 questions came directly from that. Laparoscopic surgery, snake bite, all of that. So I've seen the cases, I would go answer them. It was like that. And it's just about consistency, sir, and having a positive mindset. That is it. I mean, it's not possible to do like 12 hours at a stretch in the last 1 month or something. You have to be consistent
from the beginning. One last question to you, Dr. Priya. Which branch you are going to take up next and why?
I'm inspired by you, sir. So general surgery it is.
And I am really happy to guide you further. And once you're into surgery, that becomes utmost responsibility for me to make you much, much, much better than surgeon, than me and anyone for that matter. Okay, what all I could not do, what all I could not achieve, I will make you do that. Okay, so welcome to surgery. And okay, I am sure. I just I shared a post today. A surgeon should have, a good surgeon should have a eagle's eye, which you already have, a lion's brave heart. Again, you are the best example. And third thing, you should ladies' hands. So that skillful, very far, very hands that you're already blessed with already by birth. So you will make a very good surgeon for sure, Dr. Priya. And don't forget us after you become a great surgeon. Okay, that's our request.
I am humbled, sir. Thank you.
I know the amount of support your parents have given you to make this possible today. So I congratulate them also. And once again, I know you are getting late for your duties at hospital, so you need to leave for the duty. So continue, keep up your good work, and continue to inspire us, Dr. Priya. Thank you so much.
Thank you, sir.
Yeah, thank you. Next up, we have our cute little young boy, Dr. Kunj. The
Yes.
Kunj, yes. How are you?
Yes, sir. All good, sir.
All your fans must be, your messages, your inbox must be pouring in with a lot of messages, wishes from your fans. In White Army, there is a separate fan club for Kunj. Okay, there are so many students who just watch Kunj's videos on White Army, Kunj's case presentation, and because there are ample case presentations and other videos by Kunj alone. So I'm sure by those presentations, he must have gained a lot of confidence, and the amount of hard work which he has put in, even in the for the final year also, final year examination also, he did really well with those presentations and all. So what's your success story, Dr. Kunj?
First of all, sir, like the one main motto is like start early and be dedicated to the rank you want. Like this were the words of my senior from pediatrics, who was like guiding me since my end of final year and internship. So the two main words were like this: be consistent, start early in internship, and be dedicated to the rank you want, and give as much as like the grant test you would like to give, because like grant test is like a mock exam for
self-assessment. Self-assessment,
like a test match for the main rounds. So like attempt the grant test, like improve your, like see the mistakes, analyze the mistakes, and then improve the mistakes. That's the main nutshell, like how.
Dear friends, Kunj is doing internship in at another most like patient-loaded hospital in our country, that is LTMMC and Sion Hospital, Mumbai. He has secured at another amazing rank of 96 or 98.
94, sir.
I'm sorry, 94. Okay, 94. Okay, so great. Okay, great, really great. I don't have any words. So, how did you manage in your internship? I am sure you would have not skipped your internship for just studies. You would have managed there also and here also. So, how is that possible?
So frankly speaking, like once the internship began, like in the initial months, like we had heavy postings like surgery and OBGY. So in those months, like in those 2-3 months, I wouldn't study. Like I didn't open the books per se. The final years got ended late, and then internship was beginning. So I didn't want to open any books. So I just focused on the internship, like whatever patient exposure, like the whatever you learn from the patients and the rounds and the OTs and whatever you get to do hands-on. So I was focusing more on that. So once the major postings got over, then once the PSM started, I could like get some time for like starting the first read. So I managed, like I almost started from October, November period. And from there, like first of all, what I learned is that whatever timetable you make on a daily basis, it somehow never gets accomplished. So that is the one thing. So like you should make a timetable, try to achieve it, but somehow for me, it never worked for me. So whatever I could achieve, I could put a tick mark on that, and the rest of the topics I tried to manage on some other day or some other time allotted. But whatever the subject timeline which you have given, so try to complete. If it doesn't get completed, then skip the remaining portion and like do it on the another allotted day. Like do not like use some other subjects time for the completing that entire one subject, because after giving final year exams, you at least know like some part of each and every subject. You don't have to go and read the entire part again. So just you have to brush it up, just a quick glance, like you like, because it's an MCQ exam, not a Viva exam where you have to remember everything. You just have to, like 4 options are there in front of you, answer is just in front of you. You just have to like rule out the wrong option and then select the final answer. So that was the main thing.
So what is your mindset? Were you stressed up, or what was your on the day of examination or a few days before that? What was going in your mind? Were you so confident about a rank or such a good performance in the examination?
No, I never expected so much. Like in the last week, like I didn't like there were many thoughts coming, like how would the exam be, how would the results be, but then like somehow like you need to like prevent yourself from getting distracted and go into that Zen mode. Okay, whatever will happen, let it be. Just focus on this last 7 days. That is your main target. Like just focus on the exam, your notes and your important points which you have made for the last minute revision. Just glance to them and be self-confident. Okay? Like, yes, you will remember the main things which you have done. You won't go wrong. Like just believe in yourself. That's the main thing.
How
And
many questions you attempted?
196.
Why you left 4?
Those 4, like one was on PSM, another 4, like I didn't have any much clear idea. I won't rule out any 2 options, so I better off left them. So that was it.
So what next? What next? Which branch you want to take up and why?
Up till now, from this at this point of time, like a medical branch more than a surgery branch.
Now that 94 means anything, anywhere is available. So you have all the options.
Yes, sir.
So what's going in your mind?
Uh,
Medicine?
Mostly medicine or pediatrics, but medicine like more than pediatrics.
Pediatrics suits you more anyway for your nature.
Yes,
So, pediatrics suits, but medicine is a very good subject. Okay, then after that you have again option to take up like super specialty DM in any like the branch of your choice. Okay, so
I
I'm
haven't
sure
thought about
Dr.
that
Kunj,
yet now.
for your good nature and that smile on your face always, and the level of care you show for the patients, I'm sure you will become one of the most sought after doctors wherever you go. Okay, I'm very sure about that. Whichever branch doesn't matter, the place where you in doesn't really matter, but Kunj alone matters. Okay, how good you are with the patients, how much you take care of them, how genuine, like how nicely you take care of them. That's what really matters, and you are very good in that. You are very good in that. So I'm sure all the patients will be like coming just to talk to you, just to get see your smile, or maybe just if pediatrics, just to hold their babies in your hands. I'm sure about that. Okay, so Kunj,
Thank you, sir.
you have contributed a lot to White Army. I'm really indebted to you by your presentations, by your questions, and so many things you have done. That will remain forever, and all the juniors and even the seniors also. For some PGs also
Yes.
watch your presentations. They'll
Oh.
immensely get benefited. So continue to contribute. Okay, how much
Yes,
busy
yes.
you are,
Yes,
and
sir.
please make us more and more proud. Okay, thank you so much,
Yes,
dear
sir.
Kunj.
Thank
Okay,
you very much,
please
sir.
be with us. Please be with us.
Yes.
And meanwhile, we have Dr. Anand Hegde. Dr. Anand Hegde, who is who did his MBBS from again at another prestigious institute of our country, that is KIMS Hubli, and he had recently in last AIMS exam he had got a very good rank, but then I don't know why he chose to write again exam again. Now that he has got a good rank of 1200. So Anand,
Hello, sir.
yeah, like what's
Uh,
your story?
yeah, sir. Thank you so much for inviting me to this session. So actually, I'm a post intern. So internship, I didn't read anything. After internship, we started in around July or August. After that, I gave around 1 month back. I took a holiday from the duty. I was doing the rural service.
Service.
From there, I gave a INI CET exam. There, I got around 800 ranks. I couldn't get my desired branch in the INI CET. So I started to prepare again in the NEET PG. I gave around two times revision for the NEET PG, and here I am
This
getting
rural
a
service
rank of
is compulsory
around 1222.
for all of you, all the batches in Karnataka.
Yes, sir. It's a yes, sir. From all government colleges, it is compulsory, sir.
What if you get a very good rank in internship?
Yeah, we can give the bond and we can leave the job. We have to give the bond that we'll
So
continue
only
the,
way out from the bond is to get a good seat, a good rank, just like our Neha
yeah, sir.
did. See,
Exactly,
she
sir.
escaped bond now. She escaped bond. Even Pallavi will escape from the bond. Okay, I don't
Yeah, sir, definitely.
advise that. It's good. See, Anand, Ravikant, many of your core members already doing rural service and simultaneously studying. They're having a very good experience there, doing independently managing all the cases. Okay, that's
Yeah,
also good. Okay, and simultaneously studying, putting some extra work and studying hard, and they've shown that it's possible, even with hectic duties like that, night duties, everything, it's possible to get a good rank, decent rank while doing that. So what was your revision strategy before the examinations, Dr. Anand?
30 days, I used to divide, for example, there will be 200 questions in the NEETPG. So I used to divide like 200 by 30. So per day, I have to complete 7 questions. That means 7 questions will come from around ENT. That subject I have to finish. If I have to do the OBG, I can take 3 days, because in OBG there will be around 20 to 25 questions. So that kind of revision strategy I had. So I used to see for which subject I have to give more weightage. For which subject I can
weightage wise.
Yeah, that is a big factor, because all 19 subjects will not fetch you good marks, because in medicine and all it will be covered in pathology and pharmacology. You need not give much importance to the medicine. So that was my
and more than that, you would have finished it recently and worked in the medicine department, so you
final year. Yeah, definitely.
Yeah. So on the exam day, what should be our strategy? Many of them, they study well, okay, but they become very anxious or nervous during the examination. That's the most common problem most of all of us are facing. So they become thought blocked, even though they know, they get confused, or when you get that ambiguous questions, especially answer, you know it, but still you're not very clear about that, very sure about it. So how to go about in such a situation?
Yeah, actually, if you ask the other core members right now, I might be having a different opinion, because I had a different experience in this examination. Actually, I was school only till 2-3 days and all. I was like, okay, but the day before the exam, I couldn't sleep a single minute of the examination, like day before the exam. So, but I wanted to tell you that people, it doesn't matter even if you don't sleep. That adrenaline rush will get you through the exam. That was the whole 1 year of performance will come into the picture. That one day will not matter at all. You have to say to yourself that you have done your best and you have to give the exam, because giving the exam is an art.
No repentance.
Yeah, definitely. Even if you can't sleep, or if you can't, some people will have that problem. Some stress level will be there, so they cannot sleep. But that sleeping, not sleeping should not give you a feeling that you cannot do the better in the exam. That thing should not be there.
Understood.
Yeah. Apart from that, giving the exam in the exam hall, it will be fine only. When you sit in front of the computer, everything will come into the mind, because when you see the options, it will come. Before you go to exam, if you try to think any subject, it will not come to your mind, because you have 19 subjects in the mind. So it will be difficult for the mind to get all the information.
Yeah. So I also tell the same thing to my juniors when they are like, I say before the exam, you have 1,000 questions in your mind. But when you sit in the exam hall, you have only 10 or 15 questions in front of you in the final exams, maybe. So all the other topics or whatever there in mind goes away. So entire mind focuses on only those 10 or 200 questions in your MCQ, whatever. So our brain becomes so free and relaxed, and whatever you studied very long back, maybe in 12th or in first year MBBS, everything comes front. And you can answer. Okay, so nothing to get stressed or worried about that. I may not be remembered. So what next, Dr. Anand? What do you want to take up and why?
I am interested in medicine branches, sir. Like I'm not sure about whether I have to take medicine or pediatrics or dermatology.
No, you will get for 1,200 you will get whichever you want. Okay.
Yeah, sir, definitely.
That too in a very good college you will get. Okay, so you have all the options open. You can choose among the best now. Okay, so that should be the our situation. Okay, wherein you can choose between the colleges or the branches. Okay, very nice, so nice. Okay, thank you so much, Anand. You also have contributed from your UG time. Okay, whenever we requested you to prepare for quizzes or anything, you readily agreed, and you contributed a lot to White Army, and all the members have benefited a lot. Hopefully, once you join the PG also, medicine, you take up medicine better. Okay, because in medicine ward, so many interesting cases will be there, and the nice spotters will be there. You take the photographs of all those cases. Okay, you get into a very good hospital. Okay, I pray for that, so that we get more clinical photographs, more clinical signs and demonstrations. Okay, everything. I'm so selfish. No?
Definitely, Anand? Sir, definitely.
I'm so selfish.
No, sir. No, sir. Your blessings and your wishes has like it will boost our confidence.
Yeah. See, that's what. See, your previous rank also boosted your confidence to this.
Yes,
Okay.
sir, definitely.
See, AIMS you had got good rank, but yeah, just you missed a good seat. So that would have boosted. Yes, possible with minimal studies, whatever I did, I got a very good rank in AIMS. Now, if I prepare a little more, I'll get a very good rank in NEETPG.
Definitely.
That's how. That's the small boost ups like that will carry forward. Okay. Very well. Very well done. Congratulations, Dr. Anand. I'm really
Thank
proud
you, sir.
of
Thank
you.
you so much.
Really proud
Thank
of you. Yes, thank you. And why I kept her at the end, because she's the most valuable player of our team. Okay, Dr. Neha. Okay, I have no words to like remaining to praise her or describe her. Okay, excellent student, very studious, very energetic, and very friendly, everything. Okay, but when it comes to the matter of studies, or she is the extraordinary, brilliant Neha, who has contributed immensely to our White Army. In the internship itself, she has secured 1,400 rank. That too, being an internet, I know personally how it's there in the Bangalore Medical College. Internship is most hectic. Most hectic is maybe Bangalore Medical College. So working in such a institution and getting a 1,400 rank, okay, it's incredible. Okay, Neha, congratulations. How it feels?
Thank you so much, sir. Thank you so much, sir, and thank you to the entire White Army family. It feels good, and it's really good. I'm grateful for everyone's blessings, especially.
No, you made it. You showed us that it's possible. Okay, it's possible. Many of them feel like no, it's not possible. I'll drop an year after internship, and then I'll study, and then I'll take up a seat. No, that's not the way. What you people have done is correct. Just show some extra, put some extra efforts, show some more interest, and prepare simultaneously. So, what was your study strategy during your internship?
So during internship, mainly I felt the most important thing was the strong foundation. So even though most of the revision part and consolidation part happened during internship when I was mainly solving MCQs, but most of the learning happens right from first year. And I think especially in White Army, we have created this environment where we encourage going to practicals, encourage presenting cases, discussing with seniors. So a lot of questions were from those things. So I think my main like recommendation to juniors would be they should not skip things like practicals and standard textbooks in their foundation years to study for cracking exams. Like it's difficult to imagine how much, it's difficult to imagine how important it is to read standard textbooks and how important it is to go for those case discussions, go for clinical postings, attend the labs and everything, because the memory that you make from that of the things you learn it's more permanent. And just solving MCQs and reading revision notes and all is just for consolidation. It definitely you can't learn from revision notes. I think sir got disconnected. So your video is not.
But something happened to my mobile. I don't know. Okay. No, I joined back from laptop. So yeah. What was your revision strategy, Neha? Just before 1 month before the exam or so?
So for the revision, I mainly went through the revision notes that were available for each subject. And I had also made quite a lot of notes during my MBBS days. So I just revisited those. And but most of the focus was on MCQs. I did at least the past 5 to 6 years question papers. And I was not, instead of solving it as previous year questions, I solved it like a grand test itself. I took it like a proper exam. And by solving previous year questions, I got to understand the tone of the exam and what they focus on. And there were a lot of clinical oriented questions, and there were a lot of questions that we learned by working during internship, and a lot of practical based
Neha,
questions. So,
please tell me, because we both are from the same institute, and I usually recommend my juniors. Okay, even I followed. Usually, I don't know whether it really works or not. Okay, you should tell me. I usually recommend for the interns, like how to divide the subjects to study during internship is whichever subject you're like, whichever the branch you're posted in. Okay, for example, first you are posted in medicine. During that time, try to finish off entire medicine subject. Okay, along with it, some one short subject like psychiatry or so. So that what happens is you will have a target. So within that 1.5 months of medicine posting, I have to finish off entire medicine. Okay, that's one target. Or else there is no target at all. You can be like, oh, postpone, keep postponing. Today I'm tired. Let me study tomorrow. So that kind of postponement will happen. Second thing is, like you said, there will be grand rounds. Okay, teachers they'll be doing rounds in the morning. They'll ask some questions. So if you're reading that particular subject, means you'll be able to answer them better. Okay, so your confidence levels also goes up. Thirdly, if you have any doubts while studying, you can immediately write up. They will have your PGs or consultants to help you out. So in those three ways, you can finish off the entire subject, and any doubts can be clarified. And third thing is you can answer also better and boost your confidence levels. So similarly, when you have small postings like ENT, Aftal, there you can finish off even one extra or two extra subjects from the pre-clinical and paraclinical. So does that sound good, or any better strategies are there during internship to study?
yes, I definitely agree with that, because also you see patients, then you're reading about it, so it becomes a very solid foundation. So studying the subject in which you're posted is the best approach. Even I felt so. And also towards the end, like 1 month before the exam, short subjects yield most of the questions. So I'd recommend focusing on those like DOMAT, Oftal, ENT and all, since the quantity of the subject is short and the yield out of it is more. So it's the best use of time instead of going and drowning in the medicine ocean or something, because it's never ending. So if you've already done medicine during medicine postings, then it gives you a lot of time during the final revision to do high yield subjects.
Nowadays, they are asking more of image-based questions and case scenarios. This time also it was the same scenario.
Yes, so there were a lot of image-based questions.
So how do you really prepare for that? Image-based questions and these case-based questions.
So the best way to, I'm not sure about the best way, but what I did was I went through the previously asked image-based questions. And also when you're reading an MCQ and you feel like if they've mentioned, suppose some kind of inclusion body or for example, some stain and or like crystals in the urine, you should always Google the image immediately and have a look at it, because if you postpone that, it's never going to happen. And if you take screenshots of the images you have seen and just saved it in your gallery, then you can always go through it and it's more approachable fast. So I had a few, in my gallery, I've saved quite a few of the image-based questions, like even cannula, not just, like those memorization topics, image-based, and a few short things. So that you could just go through whenever you're free. So it gives.
What do you do during your leisure time? Internship, if you get a break or so, what do you do? Mostly.
So if I got break, I studied or slept or something like that. Yeah, I don't know. Our breaks was not evenly divided. Like in PSM, we had more breaks, so I was able to study more during that time. And in some postings like medicine and OBG, it was more hectic, like what Kunj said. So that time it was hard to take breaks, but yeah.
No, good. It's a way of converting temporary memory into permanent memory. Okay, whatever, you have to sleep more because the brain requires some rest to process whatever the inputs you have put from temporary short memory to long-term memory. So that's a very intelligent way. Good answer, Neha. Okay, so it's not just studying all the time, but your brain requires equal amount of rest or time to process these whatever the inputs you are given to permanent store in the brain. So enough rest is also equally recommended. Okay, so what's next, Neha, for you? You want to take up and why?
I'm interested in ophthalmology.
Oh, great.
So
I know
like,
why. I know because Kunj, both the parents are eminent ophthalmologists.
Yeah.
no,
We just want to continue their legacy.
no, I'm interested in ophthalmology because that branch has a good balance of different things. Like there's surgical, there's medical
Yeah,
part of it, and good
perfect.
work-life
And
balance.
it's the most advanced also. Okay, because
Yeah.
of lasers and all, it made ophthalmology very advanced technologically and sound also. So it's a wonderful branch. But one thing you remembered here, it looks interesting, but it's the most vast subject. Although it's so small, okay, there is maximum to study in ophthalmology. Okay, for example, retina. How many layers are there?
10 layers.
For each layer, there is a voluminous book. This big book for each layer. I don't know. Okay. So voluminous is your ophthalmology. So be well prepared for it. Okay. I'm sure you will again do well and make your parents as well as the Vitami members, the core team, family, everyone proud. Okay. So keep contributing to the medical field in whichever branch you are, wherever you go. Okay, so keep inspiring us and always be happy, Dr. Neha. Okay, that's all my prayers and best wishes for you.
Thank you so much, sir.
Yeah, so finally, I would like to ask three of you, what's your suggestion or the piece of advice for your juniors to achieve you better than you? Dr. Kunj?
One is like just briefly glance your notes like again and again, like read a limited part but read it again and again. That is one of the main thing. And be consistent in your preparation, and whatever rank you need, like whatever rank you are planning to achieve, just write in a piece of paper and stick it in your wall. Like your aim for this NEETPG, like the next year would be like rank so and so, and plan it out.
Yeah, this is the scene, nothing but okay. My stolen idea is by Kunj. Okay.
Yes.
I always say, you should first believe. Okay, then you will become that. So you will become what you believe. It's perfectly said by Kunj. Okay. First, you need to have that belief. Yes, I am going to take a rank of within say top 10 or within the top 100 this year. Why not it possible? If Kunj has taken, I will also take. What's the problem? Okay. So he's also a medical student. I'm also a medical student. He also read the same book I'm also reading. So why can't I do that? So you all, those who are watching his words, so should get inspired like this and believe first. First thing is to believe firmly. Yes, it's possible. I'm definitely going to do it. Then definitely all your actions, everything will be accordingly. When you believe, our actions will be accordingly, then definitely will achieve. Okay, so ABC of life is Kunj, first conceive an idea. Yes, I want to take first rank in upcoming INISET. That's a first conceive an idea. Next, what's the B? Firmly believe in it. You have to believe. Without belief, nothing happens. Okay. Third thing is A. Achieve. So conceive, believe, achieve. That's the ABC of life for anything for that matter, not just exams or ranks.